Forced to work from home by your employer? Laid off or feeling depressed at home? Do you want to make money working from anywhere? We'll show you how to do it from your couch. It's time for another episode of the Work From Home Show. Coming to you from their homes in Austin, Texas and Tampa, Florida, here are your hosts, Adam and Naresh.
Welcome back to another episode of the Work From Home Show. I'm Naresh Vista, as usual, with Adam.
Hey, everybody. Just working from home on the weekend.
Yep, and we are recording this on a weekend. Feels good to record on the weekend. I don't know, I guess better than the weekday. I have a little more time and can knock out a lot of episodes. And
well,
today...
it's not just that. I feel like kind of the weekend frees me up. You know, even though I don't have regular work hours, the weekend's kind of like, oh, I can get ahead. I don't know about you, but that's kind of how I feel.
That's how I feel too. And that's why I love the nights also. We do a lot of recordings at night because no one's emailing me, no one's calling me, and I can just get so much done.
Yeah. All right. We do have a guest list. Let's get to him.
Yeah, well, today we have a doctor who's joining the show, and he's also a friend of mine. His name is Dr. Sujay Sheth. He's a board-certified diagnostic radiology partner at Midwest Imaging Professionals in Chicago, and he works from home. And Dr. Sheth and I, Sujay, we've known each other for maybe like 7 years now, I think. He went to college with my brother at Cornell, and his brother, Sujay's brother, Nilay, is a good friend of mine, came to my wedding a year and a half ago here in Tampa, and so I've known him and the family for a few years, and wanted to bring him on the show because he's a medical professional. He's a physician, so he can give us some kind of inside on the ground type of insights into what's going on right now with the coronavirus or Wuhan virus, however you want to call it, what's going on at the hospitals. But even better, like I said, he works from home. So Sujay, welcome to the show.
Thank you, Naresh, for having me. It's great to be here.
Yeah, so let's just start out. Tell us a little bit about your background, your resume. Where are you coming to us from, where you live, and all that good stuff.
Sure. So happy to do that. So basically, I'm from the Northeast originally, and I completed my medical training at the University of Pittsburgh. And what got me out to Chicago was my folks actually moved out here about a decade ago, and I came out here for residency. So it was a really nice fit for me. And as you can see, I've ended up staying here for work. I took 1 year to go out to California for my fellowship training, which was in ultrasound and mammography breast imaging. But then I ended up coming back to Chicago. And basically, I've had an interesting job journey since 2017, you could say. I started out in a traditional private practice group for diagnostic radiologists. And what happened there was it was a little bit of a burnout situation. I worked there for about a year and then moved to a VA hospital, which was kind of on the opposite end of the spectrum, but just very far in terms of a commute, probably an hour and a half each way, which I'm sure listeners of the podcast and can definitely relate to.
That sounds awful.
Yeah, if you combine a 1 hour plus train journey with like the shuttle from the train station to the hospital, and I got some reading done, and I don't want to say it was all bad, but it wears on you each day after each day. So then what happened was that there was this posting on the American College of Radiology for this night radiologist job, and so initially I was thinking, well, I'm trained as a mammographer, a breast imager, and that's the most outpatient level of radiology you can get. It's just clinic appointments. We work an 8 to 5 day for the most part. And so how am I going to fit into a night emergency radiologist? Like, is this group even going to be interested? And they were excited. They said, well, you have the general skills from your residency, plus you can even fill in for us doing mammography during the day if you want to when you're off, because this job, being a night's job, I work 1 week and I have 2 weeks off. So that's the way it works, even though it's a full-time structure. And so I'm coming on the end of my week here. Tonight's my last night for this cycle, but then I'll be off for 2 weeks and then I'll go back on it. But working from home and having that kind of flexibility really made me want to try it out. And so about 6 months ago, I made the switch again, and I guess, officially a job hopper at this point, but I'm happy with where I'm at now. So that's kind of my journey to where I ended up doing what I'm doing. So
you also said something that I think our listeners paid attention to. You said you work 1 week and you're off for 2 weeks. My wife is a hospitalist, so she works 1 week and she's off the next week. But you work 1 week and you're off 2 weeks and you get to work from home. That sounds like the dream job.
In terms of the job, like you mentioned, so the premium for working at night, since probably very few people want to do it, whether it's radiology or other fields, they do allow for this 1 week on, 2 week off structure. So we have 3 night radiologists and we all basically do a week at a time, hence the 1 on, 2 off. It's interesting you mentioned the 1 on, 1 off. A lot of hospitalists and other medical professionals working in those settings do as well. And interestingly enough, the radiology market did start out with a 1 on, 1 off structure, and there are still groups doing that. But the market has turned, especially with the economy being good the last few years, it's turned to the 1 on, 2 off, and that's kind of become the industry standard. So people are finding that with a week off between your nights, it's not that much time to adjust your schedule, and then you have to get back on. So I would have to agree. I think this is a perfect setup to enjoy your time off and adjust, but still kind of have that balance.
Now, you mentioned, you obviously work in the medical profession. Most people think of the medical profession and think, oh, you have to be in office. When did you realize kind of this was even a possibility? Did you think about it at all going into it? And then have you even considered, a lot of people would say, oh, 1 on, 2 off, you could have 3 jobs and make a ton of money. Have you thought of kind of taking on more than that, or kind of how has that been for you?
So one of the perks of radiology is that since it's so tech-driven and everything is now digitized and all the images come through like a VPN and our reports go out through that same VPN, the nice thing with it is almost anybody can work from home if the shift allows for it. So if I'm doing a mammography shift where I'm seeing patients or doing biopsies and things like that, of course, that's not amenable to working from home. But if I'm reading general CTs or ultrasounds or x-rays and things like that overnight, a lot of radiologists actually have home screens outfitted for that purpose, not just exclusively work from home, but a lot of radiologists do work a couple of days from home in a lot of these groups. And so it's like having your hospital workstation in your house because that's all you really need to do your work. And I'm available by phone for any clinicians or any providers that have questions about my reads or about the patient or any technical issue with the exam. So in that sense, it's like being in a room in the hospital, but just transferring that room over here. And going into radiology, that was one perk that I had kind of appreciated because I knew that the tech-heavy nature of the specialty would probably allow for that more than any other field in medicine. And so I'm glad that's proving to be true. And I know you had, the other question was about, sorry.
Oh, it was, did you ever think like in terms of paying off loans, if it would be, just taking on another job?
Right. So interestingly enough, what I do is I do moonlight a little bit in my time off. So because I want to keep up my breast imaging credentials, the University of Chicago Breast Center where I trained had an opening for some part-time work last summer, which was kind of perfect timing because they said if you can come do some breast shifts when you're off, I actually go in probably 4 or 5 times a month and do like a regular day shift there, read mammograms and talk to the patients, participate in procedures. And it's great because it's an academic role where I'm actually working with residents and fellows as their faculty, as an attending at the University of Chicago. So kind of diametrically opposite from what I do at night, but it's a nice hybrid. And like you said, it's a good way to bank some extra cash too for some of us young physicians who are dealing with a great amount of loans, as you've seen all over the news, I'm sure. And with the current administration and the presidential election cycle, this becomes a big hot button issue for voters. So it's a real thing, and I'm glad to be able to put a dent in it a little bit more this year.
So Sujay, a friend of mine, he's an ER physician and he does these locum contracts. Yeah. So it's basically where you're a freelance physician and you can pretty much work whenever you want. And he only works, I think, 1 week of the month, and then the rest of the time he travels around the world and DJs EDM parties. So what do
That
you
sounds
do?
amazing. You need to get me in touch with him. So,
Yeah, and he's a good DJ too. What do you do in your time off outside of moonlighting?
so that's another great question because that was one of the reasons that I took this job was to really create and evolve that schedule that I have in my time off. And for the first few months, it was interesting to see how it panned out. And then I had some more goals going forward. So, in addition to moonlighting, I do like to travel a lot. So, what I ended up doing, I've done a lot of domestic trips to visit family, and they've been kind of random trips where I'd be like, "Hey, I'll come visit you. I'll come visit you for a couple of years." Like I have a cousin in Raleigh and his wife and their little son who's like 5 or 6, and I mentioned since they moved there a couple of years ago, I'll be there. And finally, I was like, "Look, I'm off all this time. I should just go." So there's a random Thursday and Friday in November. I wasn't moonlighting and I was free. And so I told them, is it okay if I come like Thursday to Saturday, even though it's not like right on your schedule? And they said, sure, like that's fine. And then my cousin ended up taking Friday off. We had a great time. I mean, it was a little mini vacation in there, but it's the quality time that really matters. And I think that this job lets you do that. And so I've done a lot of domestic trips like that. I also did a trip to Europe in December for Christmas. Took a 5-day trip to Paris and Prague with a friend just to check out the Christmas markets and the whole ambiance. I've always wanted to do that. And in addition to travel, I really picked up my working out. So I have a personal trainer coming to my building now. And I'm part of ClassPass workouts. So I do yoga, Pilates, lifting, like all sorts of workouts around Chicago. And like to try new restaurants after the workout because I'm a bit of a foodie. So hopefully that doesn't reverse what I do in the workout, but that becomes a good routine when you're off. So those are some things that I've enjoyed. And then I'm trying to read more. So getting into some more self-development books, leadership books, and things that you just wouldn't think to have time to do when you're in a 5-day every week kind of routine for work, or just makes it more challenging. And my ultimate goal is to, over the next year or two, try to offshoot and then kind of go from just being a clinical radiologist to kind of delving into maybe more administrative and consulting type of roles or operational roles within radiology, because I do enjoy that a lot. And having done my MBA back during medical school, I did a MD MBA degree. I really want to incorporate that more into my career rather than just doing clinical work, like maybe have more of a leadership role and a decision-making role. And I feel that this time off will really let me make some inroads in that moving forward.
Well, I think you shared a lot of kind of important strategies because our listeners, all of a sudden, they're being forced to work from home and you get 2 weeks off from your job. And already we've gotten questions like, I don't know what to do at home. Like I'm locked down. I can't leave my apartment. I can't go eat at a restaurant. What am I supposed to do? So I think you share some valuable tips on what you can do. And we've shared these on previous episodes as well. The reading, the working out, focus on yourself, watch some movies. There is a lot that you can do at home to improve yourself. It's not, you don't have to hop in a plane and travel around the world. There's still plenty you can do.
And the online world, like Naresh, I always tell people, is the online world is fully functional right now. So with all of the things we can do online, that there's still a lot that I even made a list this week, and it was surprising in a way where I was like, oh, I can still do all of these things that I was meaning to do anyway, And so I think it's important to take stock of that. And, whether it's self-improvement or sending emails or networking or even, Netflix shows. I have plugs on many of the ones that I can tell you about, but the list is endless.
So we talked, I mentioned earlier, your job obviously is in the medical field, and people don't really think about the medical field being something where you can work from home. However, do you have anything else, kind of any other fields in the medical world that you think might be impacted by this shift, things that people who are maybe thinking about a career change or going into it might want to look at that they can still do from home?
So in the medical field, I think radiology is uniquely suited to working from home. Some of the other fields with patient care, like direct patient care, it's harder to do. But there is to that effect. There's actually a lot of family medicine physicians and internists and a lot of them are doing telemedicine now and psychiatry as well. So this is really taking off, where they do e-visits, or they have, like we're doing now, maybe with or without the video, they'll do like a Skype session, or they'll do and actually now the HHS has lifted HIPAA restrictions on Skype and some of these other tools because of the crisis we're in, and has said that as long as the doctor has enough discretion and is making sure that patient confidentiality is being respected, then you can do certain platforms such as Skype, among others. But that e-visits, telemedicine was taking off even before the coronavirus hit. And so I think a lot of providers are starting to do that if they can, and having virtual appointments with their patients as an outpatient visit. So there is actually a lot of scope for it, even in other fields now, except for the ones that are purely procedural, where you're doing an operation or you're in the procedural room like an interventional radiologist, where you just actually have to be there physically. But there is more outside of radiology where the working from home is taking off, and I think that's going to only increase as we move forward.
Yeah, and that's something that not even if you're working in the medical industry, but for people at home now to think, hey, I don't need to go into the doctor's office necessarily, and knowing, keeping up to date with this so they know, oh, I can, use a teledoc and, not have to sit in a waiting room for 45 minutes if somebody's running late, or if the doc had something else going on that took them, that bumped their schedule back. So that'll be really helpful as that moves along for not just the workers, but the patients as well.
Absolutely. And I think that with so many of the restrictions right now, I think one thing for patients to keep in mind, like you said, is that a lot of us are available in a virtual format, and we can still effectively provide the clinical care that way.
So Jay, you said that you're a diagnostic radiologist. I know there's also the interventional radiologist. What's the difference between the two, and what exactly do you do that's different?
So the diagnostic radiologist is the traditional radiologist that people think of. We interpret different imaging modalities, whether it's MRI, X-rays, ultrasound, CT, any of the patient imaging studies that come through generally go through us, and we're subspecialized into various areas. Like you have neuroradiology, where they look more at the brain and spine, and you have musculoskeletal. They do a lot of sports injuries and a lot of the shoulder, knee MRIs for athletes, so on and so forth. So those are all diagnostic radiologists. Interventional radiology is more procedural based, so it's a lot of vascular access, where you're accessing different vessels and you're actually going in and stopping bleeding, or opening up a dialysis access. And they also extend into other non-vascular interventions, such as putting in drains for abscess or biopsying different tissues. All of it involves needlework, and it is almost like a surgical feel to it, where you're in like an operating room doing these things, using image as guidance for them. The thing I note for people that don't know is that a lot of us in radiology that are diagnostic also do some interventional procedures related to our specialty. So even though it's not as extensive as interventional radiology, even as a breast imager, I did some breast biopsies, or I still do when I go into the office. And I'm musculoskeletal radiologist. Even though they can read from home or they can read from their office, they can also see the patient, do nerve blocks or do arthrograms, things like that for sports injuries. So that's kind of the divide between interventional and diagnostic.
So whenever you talk about working from home, obviously that means that you can go anywhere with an internet connection and be connected. Do you worry at all about your job being outsourced to anywhere else in the world? And the other question that my wife really wanted me to ask you was if you were concerned about artificial intelligence or computer readings eventually taking over, your specialty.
That's a great question, Adam. I get that all the time, so I'm happy to go into that one, actually. One point I'll make about working from home for radiology is that we have special monitors that we have to use for the imaging criteria for the imaging. And so as much as I'd like to, I have to come to my apartment where the computers are installed. So it's not quite as flexible yet as somebody that can pop onto the laptop, although I wish that were the case. But so that's something to look for in the future. But right now, it's still my workplace, even though it's at home. Unless I schlep it somewhere, which isn't so feasible. But and to your other question about AI and some of the advances in radiology, and it's a really exciting time because so many different things have come out, including Watson and some of these other ones that were been in different trade shows over the years. But the thing with AI, and I always tell people, is I'm not afraid of being replaced by AI. And it's a two-part answer. I think the first is, I know you mentioned outsourcing. It's difficult to, and also expensive to send a lot of this to other countries based on time zones, especially for night work, because if you're not credentialed through the US system, then you're not going to be permitted to read images from the US. So people that are in other countries doing this work are generally trained in the US and then move back out there or have ties to other areas or whatnot. It's not really, we can't take up their population of doctors and have them work, let's say, in India working for the US with their Indian license. So I think it's a limited scope, and which is why a lot of groups have done, what my group has done is just hired internally, which is just a lot more feasible for them to cover this sort of work and provide this service. And in terms of the AI side, so there's that outsourcing bit, which I think is a limited threat to the field, like because of those reasons. But the AI side is interesting because radiology it's not black and white. There's a lot of nuance to it when we're reading these studies, and there's a lot of experience that comes into play that you can't really program into a deep learning network. And I think the deep learning networks are great, and they can do a lot. And we've seen it in breast imaging and other fields already. But I think what will more likely happen is a lot of the bread and butter or the so-called easier decision point cases may be able to work with AI, but I actually think that's a benefit because a lot of that work will be off our plates and we can focus on the higher level cases, the higher level thinking that really is where a human adds value, and get rid of some of the rote work that's really commoditized our field in a way, which is a whole separate discussion. But I think that would help alleviate some of the volume pressures that a lot of groups are seeing at this point and really help us to focus more on the cases that require a deeper knowledge and nuance that the experience of a diagnostic radiologist can be of value.
Well, speaking of rote work, will the technology and the AI that's going to aid you in your job, but will it decrease the number of diagnostic radiologists that need to be available?
It might, or it might actually make some of us more, like I said, those gatekeepers or higher level thinkers on many cases. But that is a valid point that there could be some reduction in staff because of volumes. But I don't see that on the horizon. I see more of, I just feel like there is going to be a management need from actual human radiologists, even when we have these things in place. And even if there were to be, my opinion is I'm not scared of it because I think that it's important to be able to pivot. Like with some of my business interest and background, I think that worst case scenario, if there's less work out there, however many years down the road, I would just want to make more inroads into my other management, other interests that will still be of value in some of those transferable skills. And so I think that it's important for all physicians to really have that in their back pocket or nurture some of that so that they're not fully wedded to just one area and they have other interests, whether it be research, whether it be more admin that I like. I mean, there's a whole breadth of things, education, teaching. So I think there's a lot of things physicians can do outside of just clinical work that are going to be important and that may become more important in the future.
You had the choice of going from an office to working from home. A lot of our listeners, haven't had that choice. It was just thrust upon them. What was the hardest thing that you had to deal with in making that shift from office to home? And how did you overcome that?
So I think for me, and especially, and this was exacerbated by the fact that I work at night, is just settling into a routine when you're not dictated by catching a train, having to get ready and be there. So I think it helps having set hours. Like for my job, it's easy because we kind of have shift hours. Like Naresh, I know your wife probably is a similar thing with the hospital shifts, but we have kind of defined shifts that we read. And so I think if you're working from home in other fields, I think it is important to delineate when you will be working because otherwise it can become very murky. And having that has really helped me to organize my time even as I work from home. So in terms of having the routine, I think it's important to also make sure you're sleeping around the same time each day, whether you're working at night or during the day. I try to sleep, in the early morning until the mid-afternoon, and that has allowed me to kind of keep a routine. And when I break it, I definitely pay for it a little bit. By the end of the week, I'm feeling a little bit more haggard or tired. So I think that that's an important thing to keep in mind. So that routine, and also making sure that if you're not going out as much, especially in our current situation, which we don't have a definitive endpoint yet, it could easily last a month or two. So being able to self-nourish and work out and self-care is critically important. And I think that having gotten into the personal training and doing more of that as I've worked from home has really helped and gone hand in hand in keeping the work-life balance and giving me something to break the day up. So it's not like it's easy to just sit at home all day and then you feel like you're kind of wasting time. But I think if you have a routine and you have things to break up your time like that, even if it's online workouts or that sort of thing, I think that going for a walk in the neighborhood, any of that is going to be really helpful for new workers from home. And then if they choose to stay with it afterward.
Sujay, are you familiar with any other physician jobs that allow work from home? And I ask this because I was listening, you've probably heard of this podcast. I think it's called like The Medical Investor, or it's like a business medicine show. And he said that my wife's job, the hospitalist, that people have started working from home, the night shift in that profession. So are you aware of any other physician jobs that allow work from home?
There are a few, yeah. And I think so. A couple of the ones that with the telemedicine and the e-visits now gaining in popularity, a lot of the family medicine and internal medicine jobs definitely do have a significant work from home component if you are able to set that up with your group. What they do is they'll do virtual visits, especially if you're primarily an outpatient doctor. You can do virtual visits with patients and write up your notes from home. And I know that that's very popular. Also, psychiatry is another one that's very amenable to working from home when you have your patient visits, since a lot of what they do is going to be verbal and talking more than anything else. And so a lot of psychiatrists I know do have a significant work from home component. Of course, radiology and even pathology, which is another diagnostic interpretive field like radiology. I'm not as sure how much of a transition they've done because they're very reliant on microscopes and staining and special chemicals, and it'd be harder to bring all of that home. But that's another one to look at, although the reality of that is still a little bit further away.
So are you concerned at all, or have you thought about how, if you decide you want to leave your current job and go do something else, about kind of how you'll approach, if you do want to continue working from home, how you approach your next employer to pitch, I don't need to be here in your office?
Yeah, that's a great question. And I have thought about how I would transition if I ever wanted to go back to a traditional setting, because it is definitely a little bit addicting to have the schedule when you have so much latitude with how you manage your time and a lot of freedom. So I think now that we're seeing more and more work from home in radiology, even with traditional groups, I do think that I would gravitate toward a job that had a significant work from home component, even if I had to go in a couple of days, and make sure to negotiate that beforehand. I think that's getting easier and easier to do as we move forward. And I think with this virus, to be honest, I think we might come out the other end of it with a much higher telework component, because a lot of times what happens is until you have to do something, a lot of groups don't. And now that they've done it, or they'll have to, I think it'll be hard to reverse that for a lot of people. So I do think one of my predictions is that we will come out of this with a much higher telework component. One great example is the University of Chicago, where I go in to do my moonlighting. They never had any work from home, and I just got an email this week because they're revamping even the residency schedules and everybody's schedule, that they're going to have one faculty from each subspecialty section exclusively work from home and put a station in there. And so I can only imagine that once people get back to the office, so to speak, people there are going to just keep asking to keep doing that now that they've already set up this work from home station. So it's just, once you start and pull the Band-Aid off, I think it's hard to say, well, why don't we keep going with it if there's all these benefits to it and advantages?
Yeah, I was telling my wife, I think last night, that I think this pandemic, as bad as it is currently, that it's going to set the work from home movement forward by about 3 to 4 decades.
Absolutely. I think that there's going to be there's going to be a lot of things that are going to move forward that we didn't actually see, just kind of being thrust forward, despite what people may have thought before. So.
All right, Sujay, we're going to stop this episode right there. We will be back with Sujay for our next episode, talking more about the situation going on with COVID-19, the coronavirus. So we're going to leave it there for now, and until the next episode, keep on working from home.